everyone, and welcome to another Heart for PCOS interview. I am so excited to be sitting down with our next guest as part of our Heart for PCOS campaign to raise awareness for the connections between PCOS and cardiovascular disease. By the time many of us realize we have PCOS, we're not quite sure what to do or what it means to be diagnosed. Our guest Rachel knows this all too well and has created a company and platform that aims to change all of that. Rachel Blank is founder and CEO of Allara Health, a virtual care platform designed for the millions of women living with complex chronic conditions. Allara currently offers a collaborative treatment model for the 1 in 10 women with PCOS. And prior to founding Allara, Rachel was the director of strategy at Roe and is a graduate of Harvard Business School. Rachel, welcome. Thank you for taking the time to sit down and chat with me today.
Thank you so much for having me. I always love chatting with you.
I love chatting with you as well. So I would love you to start off by having you share some more of your background and your experience as a PCOS patient.
Yeah, so I'm Rachel. I am the founder of Allara, and really Allara started out of my own personal journey with PCOS. So I was diagnosed with PCOS about 12 years ago when I was 20. And for me, it was kind of this moment of, I've never heard of this word before. I don't know what it means. It felt extremely scary. And I felt like it really kicked off this 10 to 12 year process of trying to figure out how to treat it. I think, it's a lot of conditions. The hard part is getting the diagnosis, right? It's what are these things going wrong with me? But once you have the diagnosis, great, it's treatable. They have medication, you're kind of on your way. And I think with PCOS, it's so frustrating for so many patients because the diagnosis is just kind of the start of the journey. And there's still so much unknown. And so I definitely experienced that myself. And I think, one of the scariest things to me was to learn all of these long-term health complications that no doctor ever told me I was at risk of. So I present with atypical PCOS or what they call lean type PCOS. And so a lot of doctors would tell me, well, you're not trying to lose weight and you're not trying to get pregnant, so I'm just not going to do anything for you. Or, come back when you're trying to get pregnant. And the more I researched and learned, wait a second, regardless of my weight, I'm at higher risk of cardiovascular disease. By the way, even though I'm thin, I have high cholesterol personally. I'm at high risk of diabetes, regardless of my weight. I'm at high risk of things like pregnancy complications, like gestational diabetes, regardless of my weight. And why is nobody talking about this? Not one doctor had ever mentioned this to me. And it was just so mind-blowing that I just felt like we needed something for the women who are trying to manage their conditions, but are not necessarily trying to get pregnant right this minute, because there are a lot of solutions if you're trying to get pregnant. And so really what we built Allara to do was help manage the chronic care needs of women with PCOS that fall outside of trying to conceive, that help you lead healthier, happier lives. And by the way, probably means you will also have a healthier pregnancy along the way.
Absolutely. And I'm so glad you brought that up because, no one is saying that infertility isn't important, because it is. It's a huge part of PCOS, and so many patients with PCOS have to deal with infertility in some form. However, when we continually have websites that point to PCOS being a condition of reproductive age women, we are missing so much of the picture. And it's so important that we have platforms and companies like yours that are kind of getting back to the root of all of this and kind of refocusing and redirecting where our thought process should be as far as PCOS is concerned. So with that, why do you think PCOS is still relatively unrecognized and providers aren't putting all the symptoms together for diagnosis?
Yeah, it's actually been really interesting for me to see what, being so versed in it, seeing what things look like today versus when I was first diagnosed. Even up until a few years ago, I didn't want to tell people about having PCOS. I felt very ashamed about it. I think partially because historically it has been so linked to fertility, and as a woman, feeling like you're not as fertile can be very shameful, even though it should not be. And I feel like that has actually really started to change in a really wonderful way in the past couple of years. I think especially due to the work of advocates like yourself, of women who are willing to, speak publicly and use their voices. I think that's been so wonderful to see. But, I really think for a long time, women were living in silence. And for a long time, a lot of the decision makers in the room were men who maybe didn't have the experience of a woman and didn't understand what it was like. And for a long time, we kind of let our shame allow us to suffer in silence. And so I think the first step is creating a community and a platform where women can share more of their experiences and can be more open about them, because I truly think to some degree people just didn't know. And I think that's true. I mean, it's hard to say like doctors, but if you think of decision makers like at the insurance company, the person who's deciding whether or not care is covered, right? Like a lot of them haven't heard of PCOS. They don't know what it is until they have a wife or a sister, or I've heard a celebrity talk about it. And so I do think part of it is just the public awareness around it has been so minimal that key decision makers at insurance companies, at the NIH, at pharmaceutical companies who have tended to be men, just it didn't occur to them that this was an issue.
Yeah, no, it definitely it still doesn't occur too.
Yeah, yeah.
Unfortunately. But yeah, I think that the tide is really starting to change. We're starting to get it. And hopefully within a few years, PCOS is really going to start picking up more
Yeah,
steam and more recognition. I'm hopeful. I'm hopeful.
I
So
am too.
do you think a lot of providers have put an emphasis on the way someone appears as opposed to why they're dealing with what they're
Yes.
dealing with when it comes to PCOS?
Sorry, I didn't even let you finish, but
No,
I
you're
think we
good.
have such a, and I get so worked up about this because I do think we have such an issue um with appearance shaping medical care. And I think it goes both ways. And I'm sure for somebody who is overweight, it's very frustrating to hear this, but I feel like I have not gotten adequate medical care because of how I look. I have been re-diagnosed with PCOS 3 times because doctors simply don't believe me when I tell them that I have PCOS, or they tell me that there's nothing to be done for me, even though secretly, I'm at risk of all of these serious health complications. And so I have found it to be incredibly frustrating that because of how I look, I've been denied medical care. And I can only imagine how much harder that is for somebody who, is maybe in a body that is bigger and is told, just go lose weight and then come back. I think there is so much dismissal over based off how we look, that again, I think happens sadly to most women, regardless of how you look.
Yeah.
Like there is some sort of a dismissal happening, whether you're told you don't need help because you're too thin, or you're told you're too, fat to get help, or you're too fat to get IVF. I think it's just so upsetting. And I think we really need to start looking at health in terms of, health metrics, like, for example, what do your cholesterol levels look like? I'm thin, but I have very high cholesterol. You might be overweight and have completely normal cholesterol. Like our size tells us nothing about how healthy our arteries are. And so I think we really need to get to this place of understanding that, we need to be looking at health metrics and not what somebody looks like.
Yeah, absolutely. And it's also a big problem because beyond the physical complications that we deal with, patients with PCOS are at higher risk for a lot of mood disorders. Some of it
Yes.
is due to hormonal issues, but if you think about it, if somebody's constantly, focusing on the way you look, then oh my God, you're feeling guilty. You
Yeah.
have anxiety, you have depression, you have eating disorders. So it attacks us in every possible way, every single system.
Yes.
And we have to be cognizant of this as advocates, as patients, and definitely as providers that
Yep.
we have to listen to each other and communicate
Yep.
and understand one another. So
Yeah. And I think it's so interesting actually, just to add on to that. I
mhm,
think we do underestimate the impact that mood disorders have on PCOS patients. PCOS patients are at 3 to 5 times higher risk of having anxiety and depression. And I think part of that is hormonal, but a lot of it I think is because we are dismissed in the medical community. And it is amazing what we see in our patients is we do anxiety and depression screeners on all of them because we know that they are high risk. And it's amazing when we see some of the improvements in these mood disorder scores simply by having better access to doctors and nutritionists who are helping them manage their care. And so, for example, when we screen for providers, we screen not just for medical expertise, but we truly screen for their bedside manner, their empathy. Are they willing to sit and listen? Are they welcoming to a patient? And I think simply by a provider treating their patient differently, it's shocking not only the impact that they can have on their health, but on their mental health as well.
oh, it's huge. It is definitely huge. And I hope that people and providers learn from you guys because I think it'll be a game changer as far as
Mm-hmm.
PCOS care is concerned. So speaking about care, why is it important when we're talking about communicating to adopt an individual approach and create a partnership between patients and
Yeah.
providers when it comes to care?
Yeah. I think, one thing that's really frustrated me as I went on this treatment journey was how much, one size fits all information there was out there on the internet. You would read things like, okay, don't eat gluten and dairy and don't do HIIT workouts. And it's very one size fits all advice that it just didn't make sense to me. And I tried some of it and it didn't work for me. And at the end of the day, number one, many people have a different combination of symptoms. Many people have a different, set of health goals. Some women never even want to get pregnant. So to them, infertility isn't an issue. Some women, all they care about is getting pregnant. Some women, we hear a lot, women actually care a lot about the fatigue that they have with PCOS, which might not be the first assumption you have of somebody's pressing concern. But so I think it really needs to be an ongoing dialogue of, not just what's going on in your body, but what are your goals? What's most important to you? And how do we help optimize and help get you there? While also pointing out what you might not be missing. So for example, the average patient might be very focused on their weight or their fertility. They might not think like, what do my cholesterol levels look like? What does my diabetes risk look like? And that's where we really view at Allara, it's our responsibility to look out for that for you and to educate you. So for all of our patients, we are running insulin levels. We are running, cholesterol levels. We're running cardiometabolic panels. That's regardless of how much you weigh. We are running this for everybody because we think it's our responsibility as providers to help make you aware of these things you might not be thinking of. So it's having that ongoing dialogue of what matters to you, what matters from your health perspective, and how do we get you there in a way that is sustainable for you? Because it's one thing, to lose weight for a year. It's another thing to really live a healthier lifestyle and maintain it over a period of time so that you aren't experiencing things like diabetes and you aren't experiencing things like heart disease, which by the way is the number one killer of women. So we really should be putting a lot more emphasis on it.
Absolutely. Yeah. So speaking about sustainability, so often patients are looking for long-term sustainable tools and
Yeah.
resources to help them not only deal with the individual symptoms of PCOS, but to improve health, to prevent future complications like diabetes, like you said, and why we're here today, cardiovascular disease. So how does Allara help patients improve their health and prevent risks of long-term consequences like cardiovascular? I know you
Yeah.
touched on it a little bit.
Mhm. Yeah, I mean, number one, I would say this is why it's really important to us to take a whole health approach to your care and not just say, a reproductive approach. I think there are plenty of times where that makes sense. For example, if you are actively trying to conceive, it might make sense for you to, at that point in time, go to a reproductive endocrinologist and just focus on your fertility. That's not what we do. We look at you as a whole person and say, as a whole person with PCOS, how does this condition affect every aspect of your life? And how do we help you overall lead a healthier life, which in turn will help you achieve specific goals? And so as part of that, what we really try to focus on is how do we instill, rather than focusing on these like very specific goals, how do we focus on behavior change and on underlying health improvements? So for example, as I mentioned with our patients, we are running very extensive blood work for every patient who comes in. And we are not just looking at, your hormones or your AMH, we are looking at your cardiometabolic health as well. So we are looking at your inflammation levels, your vitamin levels, your cholesterol levels, your insulin levels. I mean, we're really getting a full picture of your cardiometabolic health and helping you manage that. And then what's really important as part of a nutrition plan is we really try to take like a health goals based approach as opposed to this is the number we're trying to hit approach. So instead of saying we're going to hit this number, we might say something like, all right, for the next month, let's work on goals that you can actually implement. And those goals might be walking. Those goals might be prepping your meals. Those goals might be getting more fiber in your diet. Because again, that's where the personalization comes in, because your nutritionist can actually say, here's what you're doing every day. I know you think this meal's healthy, but really you've had no fiber all day because you haven't had any carbs, and that's actually not healthy. So that's where really like personalizing and understanding, where are your behaviors maybe not optimal and how can we help you improve some of those behaviors? And by focusing on behavior change, pretty much all study will show that is a much greater indicator of long-term success because you're changing the behavior and you're not optimizing for short-term goals. And I'm sure Felice can explain all of this so much better than me, but that was really important to us when we set up all of our programming, is that it is based off long-term behavior change and not, short-term wins.
Yeah, right. So One of the things that I love the most about your company and what you're doing is that it's really all about multidisciplinary care
Yep.
and bringing it
Yeah.
all together for the patient. Because I know a lot of times with PCOS, with the symptoms and the different goals and the different health complications we may have, we're running from this doctor to that one, and no
Yep.
one's communicating, and you don't know who's right, who's wrong, what's going on. So, can you talk
Yeah.
a little bit about having everything in one place and why multidisciplinary care is so important?
Yeah. So I mean, really the crux of what we're doing is providing multidisciplinary care. And I would say, just for context, the whole reason I started this company was just because I was a very disgruntled patient who wanted something better for myself. And when I realized so many other women were struggling, I thought, this is absolutely crazy. I should build this not just for me, but for everybody. But I mean, truly what I built was what I had really felt was missing personally. And what it seemed like a lot of other women were missing personally. And I think for me, one thing that was so frustrating was, you're dealing with this condition that affects so many aspects of your life, but the care is so fragmented, right? In traditional healthcare, you go, as I mentioned, you go to the doctor. Maybe if you're lucky, you see a nutritionist. A lot of people are probably just looking on Instagram for nutrition advice, right? And I think what I found especially frustrating was when I would do this online research or look at Instagram, there's kind of the sense of, well, do the supplements, but don't do any medication, or, listen to your doctor, but don't listen to this holistic practitioner. When in reality, I think everybody has something valuable to say as long as it's evidence based and science backed. And so, why are we not bringing the best of all of that together? And so, for us, it's, we know that, labs are important. We know that for many patients, medication can be really valuable. For some patients, I know this is controversial, birth control can be really valuable. And I don't know why it's been so demonized. But at the same time, we know that, right, like nutrition and supplementation and diet change and lifestyle change are so important as well. And so, making sure that we have a place where all of that can come together, where, by the way, where those providers can talk to each other. I think that's something that we've really found to be beneficial, has been not only having it in one place, but having providers who communicate. So, for example, if you aren't tolerating metformin, your providers can communicate and say, all right, is best for this patient. What would we try next? And you get the benefit, you get the best of both worlds, essentially. And so for us, it was really important that we actually provide the tools not only for you to get everything in one place, but actually for your care to truly be collaborative and your providers truly to collaborate, because that is really how, we create, again, these sustainable, lifelong results for you.
Absolutely. So, not only as a PCOS patient, but the founder of Allara, how can companies like yours change the landscape of women's healthcare? And why is that vital to treating chronic conditions and concurrent health issues?
Um, I mean, you're preaching to the choir. I think women's health has been so dismissed for so long. Um, I mean, it was only relatively recently that women had to be included in medical studies, right? For a long time, medical studies were just treating women as smaller men, which is absolutely insane if you think about it. I mean, the fact that to this day there is still no FDA approved medication for PCOS that's on label is mind blowing. We're in 2022. Or I guess when this comes out, maybe even 2023. So even more mind blowing. Yeah. I just really think, like, what I have found so interesting is when I look at other women's health founders in the space, whether it's myself, the founder of Tia, the founder of Kindbody, so many of us built our companies out of our personal experiences and our personal frustrations. And I think that just speaks to me to the power of patient advocacy and the power of the patient voice. And so, I know you do a lot of advocacy work. I know PCOS Advocacy Day is coming up in March. I think I would make sure people don't underestimate the impact that you can have using your patient voice and your patient advocacy, whether it's advocating for yourself, advocating for other women, starting a company. Like, we have so much power, and it's been so inspiring to me to see the power of the women, who have felt frustrated and did something with it. And so that's why, again, I said I really have built this company out of my own personal experience, but I equally view it as my responsibility to contribute to, the movement forward of women's healthcare, because frankly, nobody else is going to do it. This is my mission, is to help move it forward.
And that's why I love you, Rachel. I love your company and I love what you're doing, because
Oh,
you're speaking right up my alley right now. So, one final question I have for you, which kind of dovetails off of what you were just saying,
mhm.
is why is raising awareness for PCOS and best care practices and joining in campaigns like Heart for PCOS so
Yeah.
important to you?
I think it's so important to me because, like I said, I remember being, 2021, being newly diagnosed and just feeling so alone and so ashamed. And I think there is so much of this shame burden that comes with PCOS. And I think the only way you get out of it is by speaking about it. I mean, personally, for me, it's helped me so much to be able to share my story and see, okay, I share this thing. I'm not judged for it. In fact, people, appreciate that I was willing to be vulnerable. And I think that also in turn has then helped other women feel like they can share their stories and they can remove that burden off of themselves. So, for me, it's so important to raise my voice because I'm really doing it for both 20-year-old me and the 25-year-old who's out there feeling alone and feeling really vulnerable and not sure what to do. I think it's so powerful to be able to use our voices to help all of the other women around us and to help ourselves too.
Yeah, absolutely. And I think there's something truly empowering, not only for yourself, but for others when you do finally break through that barrier and you're like,
Mm-hmm.
oh my God, I'm not going to be judged as much as I thought I
Mm-hmm.
was. Because we're, I think, a lot of times harder on ourselves than
Yes.
other people typically are when it comes to this condition. I mean, don't get me wrong, there's a lot of bias, but still, there's also a lot of love, a lot of compassion, a lot of wonderful people, providers, companies. And I think the more we join together and we speak up and we empower others, the more knowledge is going to get out there and the more help is going to get out there. So I thank you for that. And I thank, you for making this wonderful company, Allara, to help people
Oh,
get the resources that they need. So
thank you. I appreciate that.
not a problem. I would love to know, how can people connect with you
Yes.
and Allara if they want to, start figuring out PCOS and where to go and what
Yeah.
to do?
Yeah. So our website is allarahealth.com. It's ALLARA health. You can find us on Instagram and TikTok at Allara Health. And we post a ton of content on there, and we post a ton of blog articles as well up on our website. So a lot of really great educational resources on both.
Absolutely. Everyone, I am telling you, go check them out. It is life-changing. I've learned so much and I've been doing this for 23 years. So there's always something new to learn. Great content, great people. And, I will share all of your links and information along with this interview. Rachel, I can't thank you enough for sitting down with me again, for always supporting the cause, always standing up, and always being there for patients in need. It is greatly appreciated.
Thank you. I appreciate everything you do to really help. You really were at the forefront of all of the advocacy work, and it is amazing how far we've come.
Thank you so much. And everyone, thank you for tuning in for our Heart for PCOS interview, our 10th anniversary of connecting PCOS and cardiovascular disease to lower risks for the largest at-risk group of women for cardiovascular disease, women with PCOS. Until our next interview, have a wonderful day, everyone. Thank you again, Rachel, and we'll see you all soon.